All right, so thank you all for joining us today on our Facebook Live. We're here with CEO and co-founder Dr. Sophia Yen with Pandia Health, and also our special guest, Victoria Ellyse. You can check her out on social at Victoria Ellyse. She's a Philadelphia-based feminist writer who loves sharing her stories on holistic living and dedicates her time to elevating and sharing the voices and stories of Black women. So thank you so much, Victoria, for joining us. We really appreciate it. I'm going to be the moderator for this talk today. My name is Jennifer. I'm a student at Stanford and part of the marketing team at Pandia. And I'm going to be asking questions to both Victoria and Dr. Yen so that they can freely discuss their experiences as women of color and how they were able to overcome the obstacles they face. So let's get started. First of all, I wanted to ask both of you what your experiences have been like accessing healthcare, particularly as women of color.
Absolutely. I'll start first. Thank you so much for having me. I'm honored to be in this space and sharing with everyone. So accessing healthcare, it's interesting. As a woman of color, I feel that I have to go about it in a very persistent way. Like I have to be my own best advocate at times because I know that sometimes things are maybe not taken as seriously. And I'm lucky that not only am I my best advocate in any doctor's office, in any doctor's space, but to also have with me friends and family members and other people that I can talk to has really been a helpful thing. So I have an older sister, and that's definitely, she's my go-to for a lot of things. So being able to share with her helps out. Being able to talk to my mom helps out. But I definitely feel like when you're a woman of color and you're accessing the healthcare system, in particular, it helps if you can find people who look like you in those spaces. And when you can't, definitely have to be your best advocate and really just make sure your voice is heard, because we do know that the healthcare system, like so many systems, has implicit biases that are kind of just built in, and that if we're not aware of them, if we don't actively push against them, it can lead to you not feeling not heard when you leave a doctor's office. So for me, I've had fairly good experiences with most healthcare systems. I'm very lucky in that way. But I also know that I've definitely also had to be my own best advocate, and I got to watch that and model that and practice that. And it gets easier along the way.
I would say that my experience as a woman of color in the kind of Asian American community is oftentimes people will go to a physician of the same ethnicity, but that may not necessarily be in your best interest in terms of if you want the latest and greatest medicine. Because a lot of times these older established physicians from our ethnicities didn't study in the United States, didn't train in the United States, or if they did, sometimes they're not as academic. So they've started a community clinic, they have a huge following, they're serving the Vietnamese community, the Taiwanese community, the Chinese community. But an academic, we always have a resident or fellow or medical student saying, Dr. Yen, the latest paper says this. Why aren't you doing this? And when you're out in private practice, you're like a god because you own the office, you own the clinic, and everybody works for you. And no nurse is going to come up and question you unless you're blatantly doing something really bad that's going to kill somebody. But like if you aren't up to date on the latest birth control side effects, if you aren't up to date on the latest emergency contraception, your whole office may not know. It's up to you to keep up to date. And not saying that these are bad or whatever. I just, coming from academia gives me that bias, that, and sometimes I've also seen specifically for Chinatown Clinic that going there for confidential reproductive health services sometimes doesn't work out because your auntie works the front desk. And it's such a tight-knit community that you walk in there and then your auntie walks in the clinic. What are you doing here? Or not even an auntie, but a friend of your auntie comes in there. And by the end of the day, your auntie knows that you were at the health clinic, but that was not scheduled and that was not within your mother. Your mom didn't know about it. And now your mom does know about it. And now your mom's going to ask you about it. So there are, I think, times to access your community for general care for sure. And just in general, if you go to a hospital, somebody of your ethnicity is going to understand maybe limitations, maybe also be more aware of side effects. So as an Asian American, I'm always looking for, is there different side effects by Asian American and by the different subgroups of Asian American? And as a woman of color, I'm always looking for by sub ethnicity, not just Asian, but Latina and Black, and then even then subgroups within that. And Pandia Health being one of the only women-founded, women-led, the only doctor-led, and the only academic doctor-led company in birth control, we're actually asking our customers to self-report their ethnicity. And it's not enough just to say Black or Asian, but I love data. So even more granular, exactly where in Africa, exactly where in Asia. And if you don't know, that's fine. But if you do, then we can try to correlate that to the side effects. And then when somebody comes in and they're a newbie and they have Taiwanese, Korean, like my daughters will be a mix, then we can see, oh, how do Taiwanese respond to this drug? How do Koreans respond? And give you the one with the best profile. So just for people to be reassured, 95% of women do fine. It's that 5% that have issues, and we just want to help make them have a great experience so that they can, if you're going to use a drug, you want the least amount of side effects possible. And the more data you give us, the better that we can be.
Yeah, I think my next question leads into what both of you started to touch on, which is what advice would you have for fellow women of color when navigating the healthcare system and how to stay empowered during that process? And I think, Victoria, especially for you, I'm curious how you developed that sense of self-advocacy when you were navigating those initial appointments with your doctors.
Absolutely. So I think my best advice would be have conversations with people who you trust first and foremost. For me, that was, my parents, my sister, those close girlfriends of mine. Start by just talking to them. Like that's a setting ideally where you're going to feel really comfortable. You're going to feel like you can share openly and freely. And then add on to that every single time. So the first time I had to tell my gynecologist that like my birth control was not working for me anymore, I was like, oh my God, is she gonna think that I don't know what's going on? And I just had to say, like, my lifestyle has changed. I can't commit to taking, the pill every single day at the same time for best effectiveness. I need a different thing. And you have to remember, like, ideally, your healthcare provider there is there to help you. Like, they want to make this easier for you. They want to give you a sense of control back in your life. It is your body. You are the ultimate authority on that. Full stop. And developing that sense and that mindset switch, which was like, yes, I was there for a service, but really they're there to help me. That their service that they are providing is help to me. So if it's not being helpful to me, something's got to change. And whether that's, a conversation with a healthcare provider, changing healthcare providers, or if it's possible, finding a healthcare provider who looks like you, who maybe has a similar background. I know I personally always feel more comfortable going to other minority healthcare providers, because even if we're not the same minority, because it can be hard to find like someone who's an exact match, at least I know I don't have to explain everything from start. And that doesn't mean you can't go to someone who doesn't look like you. I know plenty of my friends do, but they might have to have that conversation in a different way. So being able to start by advocating for yourself with friends and family, and then thinking about it in terms of like every healthcare provider that you see, ideally wants what's best for you. Like they're there, they took, they went to med school to help other people. They decided to specialize in this because they wanted to help, this subpopulation. Like they have the information and it's there for you. So you might just have to be a little brave. I always say 20 seconds of braveness can get you so far. And it was uncomfortable. I had to sit down and ask my gynecologist. I was like, what can I do? And we talked about a couple of different options. Luckily and unluckily, this was right around 2016 as well. So I was really worried that the cost of birth control was either going to skyrocket because it was no longer going to be mandated under ACA to be covered by my health insurance. And we essentially came to, the IUD as what I currently use for birth control. And it's been great. We had conversations with it, but, I had to ask the questions. I had to say, I'm really concerned that my lifestyle has changed. And, taking every day is just not working for me anymore. I'm finding myself missing days, and that's not good. That's not keeping me covered and protected. I was worried about the climate that we were living in. I was like, what happens if I have to go back paying for this every single month? I was still on my parents' insurance at the time, and their insurance was pretty good and would cover most things, but it's just an extra expense. And I was looking for a solution that might be a little longer term, but not super long term. And we got to have the conversation that whittled it down to the IUD. So once we had that, then I had to think about other things, my family history and what IUD would be best. Like, there's all of these branches, but you do have to be willing to have that 20 seconds of braveness to start the conversation. I've had my gynecologist for a really long time now, so she has most of my family history. She knows already because I've been seeing her for a few years. But having those conversations at the beginning is hard, and acknowledge that. Treat yourself afterwards. I did. I felt so I was like, oh my God, I can't believe I did this. And I was like, you know what? We're going to get some ice cream. We're going to have a good day. If you have to reward yourself, do it, because advocating for yourself is hard, but it's so necessary and it's so worth it. So I started by talking just to family and friends. And then once I started to build up that confidence, and sometimes it was an event, it forced that advocacy really to just kick off, because when the election happened in 2016, and I started thinking about the ramifications, especially in terms of costs that I would have to potentially deal with, I knew, I was like, we gotta have this conversation. At this point, it's now or never. It's something that I have to deal with. I have to go through. It was so worth it. It wasn't the easiest to start with, but it definitely, now I feel like not only does my health, my gynecologist have a better understanding of me, but that conversation has made every other conversation we've had that much easier, because I know she's going to take it seriously. I know she's going to listen to me. I know that she's able to give really sound advice, but it starts with that 20 seconds of bravery. And just know it's only 20 seconds. It's just the time while you're talking. And then you get to listen to the wonderful information that the person who has studied for years and years gets to give you, right? Don't take the first response and go. It's your healthcare. It's your right. You get to choose what works for you, but you have to at least work with the system a little bit to say, yes, I'm taking this, or no, I won't take that. One thing I always tell women of color, especially Black women, if a doctor at every point refuses to give you something, tell them that you would like that written down in your chart, so that if you move to a different healthcare facility, that is noted. So a different doctor can say, hey, I see your last doctor refused to give you this. Can we talk about that? Those notes go really far for your current healthcare provider, but for future healthcare providers as well. And if you really feel that if your voice is not being heard in that room, 100% have them write that down, because a different healthcare provider might look at that, and that's going to be a start of a conversation. And maybe you'll be able to go back to something that was shut down when it shouldn't have been. So those are my two biggest pieces of advice. Start small, reward yourself afterwards if you need to, but then also know that you can always say, I would like to have the denial of service written in my chart, please. And they should do that. If they don't, then I'm pretty sure there's a whole nother thing that you would have to get into that luckily I've never had to go through. But those are my biggest tips to start the process of being a really good advocate for yourself, and be okay with it being hard and uncomfortable. It 100% is almost every time, but it gets easier along the way.
But I would say it also depends on, the doctor. It depends on the age. It also depends on the person, right? You can think of it, flip it, and say, I'm paying for this visit. You as the doctor is not the power. You are the knowledge, but you are the person I'm paying for as a tool. Paying somebody to do your taxes, paying someone to be your lawyer. They're not just lawyering and they're in power. You're giving them money to do what you told them to do. And so think of yourself as the consumer. And as physicians, we're being taught to think about, the consumer and how they feel. And, there are Yelp reviews, there are places, Google reviews, you can write up people, you can also report people. But I think Victoria hit it right on the head, is if they refuse to give you something, say, okay, please note that in my chart, and that will freak the doctor out and make them think, wow, am I truly refusing this person something? Because that medical record is a legal document that you can pull up and subpoena, but it will look humiliating to the peers if I treated one patient different from another and refused a patient treatment. I think rarely do we refuse a patient treatment unless, of course, they're asking for something that's just not right. Like a lot of people I want to know my blood type. But if there's no medical indication, you can go get your blood done. But I don't think the insurance should pay for it, because what are you going to do with it? What do you need it for? Right? So you can't ask for something that's not medically justified. But if there is a reason for it and we can justify it, then rarely do we refuse treatment. Though I did have one woman who was 23 years old, and now, not like 30, 60 years ago, went to her OB-GYN, married even, and said, I want some birth control. And the doctor put his hand on her shoulder and said, honey, don't you think it's time you had kids? And I was like, the only reason a 23-year-old married woman goes to the OB-GYN is either to have a baby or not to have a baby. And it's her body, her choice, not yours. And to not give birth control. I was like, did you report him? Because I would totally report him to the medical board, because that is just not right to impose his values on you. As physicians, we're required to give you informed consent. We're supposed to give you all your options. And that's a caveat I want everyone to share with their fellow uteri holding women, that if you have a telemedicine visit, they should give you all your options, not just the options that make them money. Because as a physician, we are bound to provide informed consent. So if the platform you're going to doesn't give you the pill, the patch, the ring, which are the 3 things we can send to you by mail, then they're not giving you informed consent. And then the difference between our company and other companies is the only doctor-founded, doctor-led, actually there's other doctor-founded, but the only doctor-led, is I've taken the Hippocratic Oath. Do no harm. And I'm bound by informed consent, which any physician providing is as well. And so we will always tell you what's best for your health, even if it doesn't benefit our bottom line. I will make money for my investors, but I don't have to do it by withholding information or by pushing a drug that may not be in your best interest. So if you ask me what's the best birth control out there, IUD with hormone. Do we prescribe that? Do I make money off of that? No, but we're here about informed consent. We're here about do no harm. And the implant is not bad either. It just depends person to person, which one, works better for you. But if you're not ready for those, then we're here to help you get the pill, the patch, the ring.
Mm-hmm. Yeah, thank you both so much for those answers. And I think on the patient side, it's also very helpful to know what the background of the physician is and what they're thinking about. Thank you. Next question is really for Dr. Yen. It's for your path to becoming a doctor and then to being a CEO and co-founder as well. What were some of the difficulties you experienced along the way as a woman of color, and how are you able to overcome those?
I think that as a, Asian American pre-med, the main thing was competition. There's a ton of Asian Americans applying for the same position. So it was harder to get into college, harder to get into medical school. And as a person of color, being lumped, right? Being all Latinas, all Asians, all Africans, be they from Africa or been in the United States for the past 50, 100 years of your lives, it's different. And in medical school, what personally irritated me was that because I was Chinese, they sent all the Chinese people to Chinatown. And I was like, I don't speak Cantonese. So why don't you send the Caucasian person who would learn a little Asian Chinese culture? Because I already know the Asian Chinese culture. And I'm going to need a translator here in Chinatown because I don't speak Cantonese. So the assumption that all Asians are the same, or the assumption that you speak a certain language. So I'd be in the ER and they're like, does anybody speak Mandarin or Japanese? And they'd be like staring at me. And I'd be like, no, but I speak fluent Spanish. And then when I was at Harvard, I volunteered at Harvard Med School. And I'd be like, I volunteered as a Spanish interpreter. So I'd show up as the interpreter and like, we asked for a Spanish interpreter. I'm like, yo hablo español. And they're like, oh. But I've seen also in the guise of cultural sensitivity, a lot of stereotyping. So they're like, this ethnicity, never look them in the eye because it will mess with their culture. And so then we must always look down on the ground. And for me, I hope to treat everyone the same. And if you want me to look down on the ground, tell me to look down on the ground. So you have to share whatever it is. I don't know all the cultures. I don't know all the traditions. And I don't want to make an assumption. Right. And then another one, you cannot touch them on the head. And I was like, really? I got to memorize that. And I got to like, are you this? Because now I can't touch you on the head, but just ask permission. Can I touch you on the head? Can I approach you? And treat everybody, you know, the same to the best of your ability. But also from the patient side, tell me if you have any issues or constraints. Certainly somebody who's sexually assaulted will always want a chaperone in the room when you're doing the physical exam. But if you don't disclose that, then, you know, we won't know. So again, I think looking that you're in control, you're paying, you can choose to take your business elsewhere if you don't like the service here, and to make that clear to the physician, you know, and you are always entitled to a second opinion. I think that is something that's kind of built in. I'm not quite sure. I haven't checked on the legal part of it, but I think if one doctor says something, you're like, I want a second opinion. And as soon as you say that, that also makes them wake up like, holy crap, did I do something wrong? Do I need to look at this? Do I need to do it differently? So feel free to invoke, I am the consumer and I will take my business elsewhere, or I want a second opinion, which just, you know, like that means they want to check on something else. And as a physician, I'm not offended by a second opinion, because if I'm right, you'll get the same opinion when you go to the second person.
Right, I think that really drives home the point of the importance of open communication in healthcare settings like that. So I appreciate hearing that from both sides. Victoria, I know we were talking about this a little bit before we went live, but I'm curious, what types of stigma did you face as a woman of color athlete, and especially as a swimmer when it came to menstruation?
Yeah, so, you know, as someone who is an athlete, I had to think about it. Like there are certain things that you have to think about. I have a uterus. I bleed once a month. Like it happens to anyone who has a uterus, or most people who have uteri actually. I think for me, it actually sped up the conversation with my gynecologist to get access to birth control. So I originally started with the pill, and I did that because I was having really bad back pain and pretty bad cramps, usually day 2, day 3, whatever. And it was affecting my one desire to go swim, and 2, like even being in the pool. Now, sometimes it felt better once I was in the pool and moving and exercising. That tends to be something that helps me personally deal with those kind of pain symptoms that happens during menstruation. But in general, I wanted something that was going to help me feel like I could regain some of that control in my life. And the pill did that. Like it made it a very regulated process, instead of it being like, you know, my cycle was a little wonky. Honestly, I still can calculate pretty well. Like my IUD regulates it pretty well, but before that, it was kind of like a guessing game. Like one month it might be 28 days, the next month it might be 32 days, and it was always kind of around the same, but I never knew, and it was out of control. And I personally am, you know, in certain areas of my life, I like a lot of control. This was not one that I loved waking up and like, oh, my back is really bothering to me. Like, PMS, like, is it coming in 3 days, 2 days? What's going on? You know, I had big competitions. Those were dates that were marked on a calendar. Like, it's not like you can be like, hi, I can't swim today. I'm menstruating really badly. I can't do it. You know, I had coaches who I could talk to. Like, luckily my team has always had a strong number of you know, women identified coaches who also dealt with menstruation. And, you know, I could ask for, you know, our trainer to give ibuprofen if I needed it or something. But really what really helped was getting access to the pill, which allowed me to really, one, know exactly when my period was coming every single month. That was a game changer. And then 2, it really just helped lessen the severity of some of those cramping, some of that back pain that I was facing, that then let me perform at my best level when I was in the pool. It helped. Like, it just, you know, there was my reasons for getting access to the pill really started with that. I wanted the control. I wanted to know that I was at least in control of my body in some way. This is, menstruation happens. It happens to people who have uteri. It's not under our control. It is a biological force. So usually you don't get a lot of control over these things. It'd be like if I was like, hey, I'd like it to rain today, and then all of a sudden I need some rain. That's not how it's not how it works. But with this, there is an option. And that was the thing that I was telling friends, I was like, it helps. It helps me be able to function at the same level that I can function every other week of the month. And why should it be any different because I have to menstruate? It's not something I control. My body has to do it. So that was a game changer for me. The ability, the back pain that kind of lessened, it went from being super comfortable to just being kind of it's there. I can still feel it. It's not super comfortable, but it's not prohibiting me from doing what I want to do, what I love to do, and what I was good at, frankly. And I think that's something that a lot of people forget. There are 1,000 reasons why a person can want access to birth control. More importantly, none of them are necessarily your job to judge or to be the juror of. That's their reason, and by all means, it can be because of back control. It can be because they have really bad acne because the hormones help balance that out for them. I mean, it can be a whole world of things. That's no one's really ability to judge between that person and their doctor, as long as it can be done in a safe way and they don't have side effects that are adverse to them. But that's why I really started talking a lot about reproductive health rights and especially birth control, because there's so many reasons for it. Everyone likes to say oh, so that you don't have a kid, and which is great. I'm 25. I don't want kids right now. That's really a benefit. But there's so many other reasons as well. And I think we forget that often when we're having these conversations, that there's so many reasons why people can want them or not want it too. Conversely, that is also your choice. You're not bound to have birth control if you do not want it. If you want to use just the normal method of tracking, that's absolutely fine. I couldn't do it, but I also do not excel at math like that anymore, and was just annoyed that the numbers never were the same. So, that's just a personal aside. So it didn't work for me, but this did. And that's what this is about, reproductive health, reproductive justice. It's about letting people take what works for them and making sure that they have access to do so. And so that's why I started this conversation with my gynecologist. It was because I loved swimming, my love of swimming. I loved competing. And, honestly, my period was getting in the way. The back pain was getting in the way. The cramps were getting in the way. And I wanted to kind of regain a little bit of control. I had heard from health classes that I had in 7th grade. I had 7th grade health, like most people, I think. They split us up, boys and girls, and then we got to talk for a couple classes. I vaguely remembered seeing something that said it could help with cramping, it could help with back pain. And so I went and I went to my mom and I said, can I talk to a gynecologist? And she said, sure. She took me, and then I got to have that conversation. And then really from there was able to make decisions about my own body. And that was the most empowering thing for me. It was, I had something I was going through. The only thing that I needed was help getting to and finding a gynecologist. And then I got to take the conversation from there. And I felt really heard during that conversation, which was wonderful. We found a solution that worked for me, at least for the first few years of my life, or in my, adult life, I guess you could say. And it gave control back. It gave me the ability to just say, this is what I want to do with my body. And someone said, that's not my place to judge. And I think that's what we have to remember. There's so many reasons why access to birth control is important, and kids might just be one of them. And even if the only reason is kids, that's enough. It's your reason. You don't need to really justify that, and you shouldn't have to justify that to other people.
Mm-hmm. Yeah, and I know in a lot of birth control conversations, we talk about the fact that women are busy. This is just one other thing that's constantly on our minds that we have to be thinking about in any sort of opportunity to introduce control, like you were mentioning, or just knowing that there's something that we can do, I think helps tremendously.
Yeah.
So thank you for that answer. And just to wrap things up, my last question is, what is something that you wish you knew about your health or your body 5 years ago?
Ooh, that's a good one. I think I would say you can just keep asking questions. Like, things change all the time. 5 years ago, I was still on the pill and I thought that was what I was going to take forever. I was like, it's okay. Like, I just set a reminder. Hopefully, it's all good. And then, my body shifted, my body changed. Like, your bodies are ever changing, not just in terms of weight, but in terms of the way they react to things, in terms of, just as you get older, things keep changing, and like, that's okay. And so I think I would tell my 5-year-ago self, like, use it until it works for you and then find something else. Have those conversations. Kind of like, I tell people all the time, when you're talking about stories, when we're talking about just having conversations, take what works for you, leave the rest behind. And it's exactly the same when in terms of your health care. Like, if you have something that's working for you, use it. Once it's no longer working for you, don't feel that you're tied to it. It's always a process. It's always changing. So like right now, I love my IUD. It's great. If it's not working for me, I'll go back to my gynecologist. I'll talk to her. I'll get, what are my other options? This is your healthcare, especially when we're talking about menstruation. Like, that is a process that you will go through for years. Like, it's not like one and done, unfortunately. Like, it is a process. If what worked for you when you started isn't working for you now, it's okay to switch it. It's okay if you want to switch, back to the pill. It's okay if you want to switch to the patch, or if you can try things as well. I think we feel really locked into things sometimes, and feel you can try it, see if it works. And then, I know with the IUD, they say give it 6 months, and then that's about a effective trial to see how your body is going to react, because it does take some time. But if it's not working in 6 months, like, leave it. I have friends who tried the IUD. It didn't work for them. They've switched to other things. I tried the pill. It worked for a while, then it didn't. Like, 5 years ago, I was like, okay, I'm on the pill. I'll just keep getting it. And things change. Like, things change. Your body changes. You're allowed to change your mind. You're allowed to do what's best for you at every step along the way. And I think that's probably the advice I would give myself. Like, in terms of your body, in terms of your health, and just in terms of you're allowed to do what's best for you at every step along the way. And you should really just surround yourself with people who know that, they understand that, and they value that more than anything else.
Yeah. And I would say, for me, you brought up, Victoria, 2 things that came to mind. One was, want to make sure everybody knows pandiahealth.com/periods optional. On the bottom is my TEDx talk on the science and safety of having fewer periods. So if you're on the pill, patch, ring, you have a lot more control than if you're on the IUD or the implant or the shot. With the IUD and the implant, about 30% of women will lose their periods. And those are like, and then the other 70% will continue, but it is a lot lighter. The implant also has kind of random spotting that can sometimes happen, or I've met a couple of women that went on it, their periods went away, and they're just good for 3 years with no periods whatsoever. But knowing that if you're on the pill, the patch, the ring, that 1 week off is optional. And you can just keep going. The caveat with the patch is you can't do that more than 12 weeks in a row, because the estrogen adds up and then you're at risk of a blood clot. But with the pill or the ring, it's okay. And then the other thing that Victoria brought up was different body at different ages. And so specifically, we have a lot of patients go to their doctor and they say, I want the lowest hormone possible. And actually, with respect to estrogen, so most normal birth control pills have estrogen and progesterone. You don't want the lowest hormone possible on estrogen, because if you're under the age of 30, that's when you're putting all your bone density together. And if you go on a 20 microgram or a 10 microgram estrogen or a 13 microgram estrogen, such as in Anovera or NuvaRing, which is like 20, then your bone density isn't going to get as high as if you were on a 30 microgram estrogen pill. So low estrogen may not be in your best interest if you're under the age of 30. Once you're 30, then we can take you to a 20 microgram pill. And once you're 40 or 50, we can take you to a 10 microgram pill, because again, you're not building up your bone density that you're going to be needing for later on. So know that your body changes, and when your body changes, then different things can be allowed. And then the other part is also who's around you. So let's say you were on the IUD and you had no periods, but then all of a sudden you have a daughter. I have a 14-year-old daughter who's now got raging hormones. And before on the pill, I had no periods. But if I spend time with her, my cycle links up to her. And if her hormones are strong enough, they take over me. And I'm like, I'm a doctor, I'm taking my medicine. Why the heck am I bleeding? And it's like, Sabrina, is it that time of month? And she's like, yes, it is, Mom. And I was like, I love you, but I won't spend enough time with you for you to infect me. So I've been very careful, like, not spend much time with her or be in the same room, because I spent 2 weeks with 23-year-old women in the same bedroom and they infected me with their period. So, so if there's a new person at work that you're spending 8 to 12 hours a day with, or you have a new roommate, that can change things. And then the IUD worked before, but now they've infected you. So you might want to go to a pill, which there's 40 different pills that we could pick a stronger one and maybe override it. Or you want to convince your roommate to consider going on the IUD as well.
If I could add one more thing, I would also say, like, ask questions. I used to be the person in the room, like, I was afraid to ask questions, but they would ask, you know, how most doctors do, like, do you have any questions? And I'd be like, no, I don't have any questions. Meanwhile, in my head, I'm like, wait, what is this and what is that? And like, it is absolutely okay. The people in those rooms, they have studied for years and years and years to be able to give this information. It is okay to have questions. You know, so when I went in and I was asking about my IUD, I was like, okay, and I have a question about this, and I have a question about this. And then it worked. The day of my IUD appointment, I noticed that they had switched something. The brand that they said they were going to give me, they said they were going to give me a different one. And I was like, wait, that's not what my doctor and I had talked about. And like, the only reason I was able to do that is because I'd asked so many questions in that like initial, sorry, my cat is just, you know,
cat cameos.
I'd asked so many questions from my original appointment that I got to understand things a lot better before I had even, you know, had my IUD. So ask questions. Like, it is absolutely okay that you do not know all this information. No one expects you to know all of the information, because you also have not studied for years and years and years to get this information. So ask those questions, feel comfortable doing so, and you'll be able to make a better decision for yourself.
And then I would add on to that, don't be afraid to write it down. So like if you're embarrassed or whatever, you can just give it to the doctor and then they can read the question if you want to go that route. And then if you think of the questions after you leave, a lot of physicians now have, you know, electronic communications where you can message them with follow-up questions, and you have every right to call up the office and say, I have a follow-up question, and they may make you schedule an appointment, or they may just take it over the phone and answer. The insurances, if you have insurance, often have a nurse advice line that you can get answers to. So definitely you're paying for this. If you have insurance, somebody's paying for this, and take advantage of it and use it. Don't be afraid to ask questions. We're, as a healthcare community, just here to help you.
Yeah. Thank you both so much for joining us today. This is a really great discussion. I just want to give a final plug to Pandia. If you would like your birth control to be delivered in any state, or you need an online prescription and you're in Arizona, California, Florida, sign today at pandia.com because Victoria is joining us today. If you use the code Victoria Ellyse, which is also scrolling by down here, we'll donate $5 towards any charity of Victoria's choice with every successful patient completion. So thank you again, both of you, for joining us. This has been a really great conversation. I hope you enjoy the rest of your evenings.
Thank you so much.
Victoria. Thank you, Jennifer.
Thank you.
Of course. See you.
Bye.